Good morning, everyone, and welcome to the California COVID-19 Vaccination Program Friday Provider Office Hours this Friday, June 17th, 2022. Next slide. On behalf of CDPH, my name is Leslie Amani. I'd like to welcome you. If you are a first-time attendee, glad you're joining us. If you are a regular attendee, welcome back. Today's session is for you. Please use that Q&A panel to ask your questions so our subject matter experts can respond directly. Next slide. To our panelists, please mute yourself when you are not speaking, and please monitor the Q&A panel for any questions you may be able to answer. And to our attendees, this session is being recorded and the recording will be available later on eziz.org/COVID/education. And the slides are there now. So if you are new to the call, anytime you see an orange link, that will take you from the slide deck to any job aid resource webpage and information. For your convenience, we drop the links into the chat. So if you wanted to open that right now, you can find the slide deck link and you could download and follow along if you prefer. If you have any post-webinar questions, please email me, leslie.amani@cdph.ca.gov. Next slide. We have a great agenda laid out for you. We're excited to have, after announcements today, Eugene Baronia and Francisco Borboa to give information about the quality assurance site visits. Elizabeth Riosti will follow with vaccine administration data, and Dr. Katarina Liu with some clinical updates. We'll have time for Q&A, and then storage and handling with Kate McHugh, vaccine management with Eric Norton and Maria Volk, and wrap it up with some resources and more Q&A. Next slide. So on our first announcement slide, as we move forward, we will be having today a planning for infant toddler COVID-19 vaccinations. This is featuring Dr. Erica Pond. It begins at 2 p.m. to 3 p.m. today. For our call this morning, we are going to bring our updates, but if you want to hear the most comprehensive update at 2 p.m. today, we strongly encourage you to attend. We currently have over 750 registrants, and we hope you're included in that number. And the registration link has been dropped into the chat for your convenience, but you will hear from Dr. Pond on the importance of vaccinating the infant toddlers with COVID-19 vaccine, along with CDPH subject matter experts, including storage and handling, ordering, clinical resources, and much more. Next slide. Upcoming COVID-19 Crucial Conversations webinar, please join Erin Arenzi on the Equality California and Dr. Scott Nass for a webinar on communicating with the LGBTQ+ community about COVID-19 vaccinations, Wednesday, June 22nd at 12 p.m. This webinar does provide CME units, so please note that when you attend, those are available to you as well. Next slide. In addition to that webinar, which features our hashtag This Is Our Shot, hashtag Vacunate Ya, wonderful partners, we are also partnering with the California Immunization Coalition this Wednesday, June 22nd from 6 p.m. to 7 p.m. And the conversation will continue on how to prepare California for infant toddler COVID-19 vaccinations. And we are pleased to have Dr. Yvonne Maldonado and Dr. Schechter, Dr. Robert Schechter, as many of you know, with CDPH. They will be part of that conversation, and you can register using the link, and that bottom banner link will take you to the CIC webpage so you can learn more about the California Immunization Coalition. Next slide. VA 58 Trust and Safety Team. They capture and malinformation. So if you look to the right on this slide, in red, the current misdis malinformation reveals that vaccines cause significant fertility complications for pregnant women. The understanding is that they are selecting For those who are not supporting COVID-19 vaccination, they're selecting pieces and using it to somewhat shift what is actually being stated in that document. So we wanted to ensure that you have trusted resources along with studies that address COVID-19 vaccine safety and fertility. So those orange links, again, will take you to trusted resources and studies. If you have any misdismal information to report, or if you'd like to attend their biweekly briefings, you may email rumors@cdph.ca.gov. Next slide. Stay informed on EZIZ, where we frequently update with alerts in real time. And we are highlighting again the planning for infant toddler vaccinations, but there are many more resources, including vaccine management, administrative tools for your toolbox to share out with those you serve. Next slide. On our next, the provider FAQs updated yesterday, and starred in yellow are new and green updated FAQs. New is our COVID-19 vaccine providers required to provide COVID-19 vaccination to anyone who is eligible, even non-patients. And it talks about the guidelines and how CDC and CDPH strongly encourage providers to make vaccine available to others in their local community as we want to vaccinate California. But details and information can be found in the links. And of course, there are updates on the authorization expected for Pfizer infant toddler 6 months, 4 years, and Moderna infant toddler 6 months through 5 years. Pardon me, that is, should be through 6 months through 4 years and 6 months through 5 years. Next slide. And the week of June 20th, next week, it is a federal holiday on Monday with Juneteenth celebrations starting this Sunday. But we are having the Monday My Turn and My CA Vax office hours that date, along with, if you view the slide, many other trainings available, including links to some of the webinars we've referenced. Next slide. And of course, we want to highlight Pfizer updated trainings happening next week. Available are the links and passwords, and that bottom banner has put together for detailed information. Next slide. And I think I have a little delay on my slides, but as we're moving on to our next presenter, we are going to hear the quality assurance site visits with Eugene Baronia and Francisco Borboa of CDPH. So go right ahead, gentlemen.
Thank you. Next slide, please. Many of us on the call may have already experienced visits with the state. And for those of us who have yet to receive a call to request a visit, please note that part of your provider agreement does indicate a request to comply with these quality assurance visits, and the link at the bottom will provide specific language in your provider agreement. Next slide, please. We'd like to share our updated numbers on this dashboard, beginning with the map on the left. It shows a cumulative number of 342 visits since the program's inception in 2021. The map indicates where those visits occurred throughout the state based on Vaccines for Children regions. We can see that the majority of the visits are in Southern California, with an amazing help from Los Angeles County, who've done quite a number of visits. So we'd like to express our appreciation to them. The icons on the left indicate whether they were in person or virtual or online, for a total of 200 in-person visits and 142 virtual visits. If you move to the center table, you'll see the number of visits conducted this calendar year from January through end of May. CDC would like us to conduct a certain percentage based on funding categories. So 10% of HRSA and 10% of Indian Health Services, for a total of 55 with HRSA, and we've yet to conduct Indian Health Services, which we're planning for the summer and fall. The depots are, if you have a redistribution agreement and you are redistributing vaccines, you will get a visit from us. So please expect a phone call very soon. And then CDC would expect us to conduct 100 additional providers this year. So far, as in 2022, we've conducted 272 visits. We may have to visit up to 460 depending on the redistribution statuses. The pie chart below indicates who is conducting those visits. Again, we'd like to express our gratitude to Los Angeles County, who've done the vast majority of the visits in 2021 and 2022. And Sacramento County is also joining the fray. So thank you for that. The next slide will indicate the top 5 non-compliances, and I'd like to pass the mic to Francisco.
Hello, thank you, Eugene. Out of the 342 visits conducted, the top 5 non-compliant areas identified during these visits are as follows. Number 1, documenting, reporting spoil, expire, and wasted vaccine. And number 2, respond to administration excursions. And number 4, providing V-Save information sheets to each vaccine recipient. And number 5, staff training. Next slide, please. Thank you. Our providers are doing an excellent job out there, coming up with their own innovative best practices to implement the COVID-19 program. The Hansen Family Health Center in Woodland from the Community Health Centers system developed a reconciliation information sheet to track their inventory, in addition to developing a color-coded labeling system to track the products that are administered at the clinical sites. Next slide, please. In addition, we have the Community Medical Centers Waterloo and Stockton that they develop a basket label that can be reused by basically laminating the label so they can, document the date when the vaccine was actually first punctured, the time and the staff that punctured the vial, but also to be able to erase it and reuse it every time when a vial is actually utilized. So with that, we conclude our QA presentation, and back to you, Leslie.
Thank you so much. And just very quickly, Francisco, Reed was asking, what does HRSA stand for again? Can you give our audience a reminder on that, or Eugene, either one?
Yes, we will type it in the chat.
Wonderful. Reed, just watch for that in the chat, so we'll have that documented for you. And a reminder to our audience, please use the Q&A field. Look for that icon. It's that double bubble, and it has the talk to ask your questions. I unfortunately do not think we are going to have any time for raised hands today. So we want to make sure that you get your questions put into the Q&A. We'll move on to hear the vaccine administration data update with Elizabeth Riosti. Liz?
Thank you, Leslie. Good morning. Next slide, please. So as of this Tuesday, June 14th, we have administered 76.9 million total doses of COVID-19 vaccine. What that means is that 83.7% of eligible Californians, so that as of this week means Californians 5 and older, have received at least 1 dose of the vaccine. Additionally, 42.2% of Californians have not only completed their primary series, but have received at least 1 booster. And 30.7% of eligible Californians who have completed their primary series have not yet received a booster. And once again, on the left, we're showing you a map with the proportion of residents who have completed a first booster amongst people eligible for a booster by county. So the areas in darker blue are those areas where a larger proportion of booster eligible people have gotten their first booster, and those areas in lighter blue or white are areas where a smaller proportion of booster eligible Californians have gotten a first booster. Next slide, please. And we wanted to show again the trends for the last several weeks. On the left, you're seeing the trends since last summer in terms of number of new doses administered per week. And on the right, you're seeing the number of new doses administered for the past 6 weeks. So this past week, we saw a slight reduction compared to the prior week in terms of number of new doses administered. We administered 100,000 new doses. And so you can see it's only a slight decrease compared to the prior week, but of course the prior week where we had administered 297,000 doses included a holiday. So the dramatic drop off between the week of May 22nd and May 29th might have been impacted by that Memorial Day holiday. Next slide, please. And again, just looking at those same data, the number of new doses administered for the past 6 weeks, but broken out by age, you can see that still the majority of new doses per week are going to Californians 50 or older. And although we did see a reduction in the number of new doses going to those ages, 50 and older, whereas the 12 to 17 and 18 to 49-year-olds, we saw a slight increase this past week compared to the prior week in terms of the number of new doses going to those age groups. And again, this number of doses would include any primary series doses as well as any booster doses. Next slide, please. And then here we're looking at the number of 5 to 11-year-olds who are newly starting their primary series per week. So we saw a slight increase this past week compared to the prior week, just over 5,300 5 to 11-year-olds who are newly partially vaccinated. And again, that drop off that we saw the prior week may have been influenced by the Memorial Day holiday. So we'll have to wait and see what this number looks like next week to see if we're maybe seeing an upward trend or just a leveling off in terms of the number of new 5 to 11-year-olds who are becoming vaccinated. And we are still seeing the change in 5 to 11-year-olds getting vaccinated is pretty equally distributed across equity quartiles. Next slide, please. Just looking again at the sort of disparities in booster rates. So we still see that amongst Californians eligible for a booster 50 years or older, 79% of Asian Californians in that category have received their first booster, whereas only 64% of Latino Californians in that category have received their first booster. We also just wanted to note that although we don't show them on these bar graphs, we've included on the bottom here the rates for American Indian and Alaska Natives, multiracial Californians, Native Hawaiian Pacific Islander Californians, and Californians reporting in other race. Because these are smaller groups and the population estimates are a little bit less precise, these rates we're not as confident in them, but these still are the rates that we see given the data in our immunization registries. Next slide, please. And just again, the summary, 76.9 million doses administered, just over 280,000 new doses administered this week, which was a slight decrease from the prior week. 5,300 new 5 to 11-year-olds who have begun vaccination, which was an increase from the prior week. Again, fourth doses are, so when we're looking at all these new dose counts, that's going to include any primary series, any first dose, and any, first booster and any second booster, although those aren't being broken out currently as their own separate category. That's it from us, but we will look at the Q&A in case there's any questions.
Thank you so much, Liz. And please do, it looks like you have a couple more slides. Did you want to cover these for this audience?
No, these are, I don't think was meant to be included. I'm sorry, Leslie. These must have slipped in there. I'm sorry.
That's okay. We'll go ahead and modify the slide deck in real time right now for updated slides on EZIC. So not a problem. Thanks for that, Liz. But if you do have questions for Liz, please go ahead and put them into the Q&A. She'll be monitoring that. In the meantime, we're going to move right along to hear the clinical update from Dr. Katarina Liu. Katarina?
Good morning and thank you. Next slide. So just wanted to note that FDA's Vaccines and Related Biological Products Committee last week voted to support emergency use authorization for the Novavax vaccine for a primary series for people 18 and over. And FDA authorization hasn't been granted yet, and CDC and ACIP in Western states haven't yet met. The other breaking news, which you may have saw in the headlines this morning, is, and I don't have a slide for this, is that FDA has now authorized multiple new products for children. They authorized the Moderna vaccine for children 6 months to under 6, and then also the Pfizer vaccine for the youngest age group, 6 months through 4 years. And the Moderna vaccine has also been authorized for the older age groups of children, 6 to 11 and also 12 to 17. So big expansion in Moderna authorization, and also now expanded authorization for infant toddler vaccines. There will be much more information shared about the infant toddler COVID-19 vaccines at today's webinar at 2 o'clock. And next week we will share much more detailed information, but you can definitely get more information at 2 o'clock. Also note that ACIP is meeting today and tomorrow to discuss the infant toddler COVID-19 vaccines, with the ACIP vote coming tomorrow on whether or not to recommend the infant toddler COVID-19 vaccine. So everything is happening very soon, but just wanted to highlight those breaking news updates. Next slide. So just wanted to highlight again, earlier this week, the FDA VRBPAC meeting was held to discuss the Moderna requests and Pfizer requests. And as of this morning, authorization was granted, emergency use authorization was granted, and then we'll have some meetings today and tomorrow, and we'll get the CDC recommendation following that. I also want to note that there is another meeting at the end of June to talk about the future of COVID-19 vaccines, including boosters for the fall and the strain composition for the fall. Next slide. And this has now changed since this morning's authorization, but just wanted to note that both Pfizer and Moderna vaccines are now authorized for all age groups of children. However, the CDC recommendation is still to come for the infant toddler formulation, and then for the Moderna 6 years to 17 years formulation. And so this expands the availability of pediatric COVID-19 vaccine products beyond the Pfizer vaccine. Next slide. Just as a summary of what we know about the Pfizer infant and Moderna infant toddler vaccines, the Pfizer vaccine is 3 microgram dose, so a 1/10 of the adult dose, and it's 3 doses per infants and toddlers, so 6 months to under 5 years. Between dose 1 and dose 2 is 3 weeks, and then between dose 2 and dose 3 is 8 weeks. The Moderna vaccine is 25 micrograms, so a quarter of the adult doses, which is 100 micrograms, and it's 2 doses for children aged 6 months to under 6 years. And it would be, the recommendation would be 4 weeks between doses. Next slide. So I think I'm going to hand it back to Leslie, and we will certainly, I'm happy to answer any questions, and also please stay tuned for announcements over the coming week about CDC recommendation and administration. So thank you.
Thank you so much. And we will go ahead and turn time over for a little Q&A this morning. And I'm going to invite Maria Volk to facilitate our Q&A. Maria?
Great, thank you, Leslie. Good morning, everyone. Let's just do a couple quick clinical questions. Save you a little typing, Katerina. So the first one, which I know is the crystal ball question, when will the second booster be offered to under 50-year-olds?
That's a great question. It's not currently, and just to link this to another question about second boosters for healthcare workers, there aren't CDC, and so FDA hasn't expanded their authorization for more groups, and CDC hasn't expanded the recommendation either. So at this time, people who don't meet the age or clinical criteria aren't eligible. Obviously, the crystal ball is very challenging to use, but there's been discussion by FDA and CDC about a second booster campaign in the fall. It's unclear which groups would be included for that campaign, although it may be a broader eligibility group than for the current second booster. So stay tuned, and I anticipate that we would have more information following that FDA meeting as well as they discuss their considerations for the fall booster campaign.
Great, thank you. A couple questions about the 12 to 17-year-old Moderna authorization, just kind of confirming. Does this cover 2 primary shots?
Yes, that's the amended EUA for the Moderna COVID-19 vaccine. I don't think it includes the boost. I don't think it includes a booster. I have to double check on that. But it's for the primary series. In terms of, there's another question about when ACIP will be reviewing this. ACIP also has 2 meetings set up next week, previously set up to talk about other things. So it's possible that they may discuss the Moderna 6 to 17, the Moderna vaccine for children 6 years to 17 years next week. But the agenda for this weekend's meetings is focused on the infant toddler formulation. And then there's a question about the Moderna vial dosage for 12 to 17. Since it's the same dose, we anticipate it would be the same vial. And as for mix and match, I think that would be pending CDC review and recommendation. So first is authorization, then CDC recommendation, and I would anticipate that they would discuss that at the ACIP meeting when they discuss whether or not to recommend the Moderna vaccine for children 6 to 17.
Great, thank you. You answered a bunch of questions. Let me just do one more. So this is a question about what happens when people go to cross different age groups in the middle of the series. So if you've got someone that is perhaps 5 when they start and 6 when they end, how do we handle that? Which vaccines do they get as they switch into a different age group?
A great question. And what we've said previously is that the child should get the dose that's appropriate for their age. So that is our general recommendation. In some cases, there is allowance for a different dose, depending on if they switched in between, but those are sort of special cases. So in general, the child should get the dose that is authorized for their age.
Great, thank you. Leslie, I think I will hand it back to you at this time.
Thank you, Maria, and thank you so much to our first section panelists, Liz, Eugene, Francisco, and Dr. Liu. We're going to move on to our next slide, and we are going to hear the storage and handling update with Kate McHugh. Kate?
Thank you. Next slide, please. So I wanted to give an overview of the upcoming vaccines that we're expecting shipments to start arriving for next week. So for the Moderna infant toddler for the 6 months to 5 years of age, the cap color is dark blue and it's going to have a magenta border. It will have 10 doses per vial and 100 dose minimum order. And its long-term storage is the same as the current adult formulation that's out there. So it is going to be -50 degrees to -15 degrees until the published expiration date. The refrigerated storage is 2 degrees to 8 degrees Celsius for 30 days. And you should not have it at room temperature for more than 24 hours. And you should discard it 12 hours after the first puncture. And it's important to note, it does not require diluent, so make sure your staff know that. Next slide, please. And as Dr. Liu was just discussing, the Moderna for 6 years to 11 years, it's not available yet for ordering, and we're going to need to wait for ACIP to meet about it until it becomes available for ordering. So we don't know quite the timeline of when it will ship, but I wanted to give a brief overview of it. So the Moderna for 6 to 11 years old is going to be 5-dose vials. It is the same vials that Moderna developed for use for adult booster doses. So the vials are going to be mislabeled when they're initially shipped because it's the vials that were originally created only for adult boosters, but it's the same dose as the dose for the 6 to 11-year-olds. So they're planning on just shipping these booster dose vials, and it will come with a letter in it for healthcare providers explaining the mislabeling and that it is appropriate for use in this age group. It also is going to be the same storage conditions as the other Modernas. So -50 to -15 until its published expiration date, and refrigerated storage for up to 30 days. And in the letter, you'll see that they note it should not be used for individuals 6 months to 5 years or individuals 12 plus. Next slide, please. And for Pfizer, for the infant toddlers, the cap color is maroon. It is a 10-dose vial, 10-vial carton, and 100-dose minimum order. The third-party redistributor will be doing small orders for it by June 27th. And the long-term storage is also the same as most of the other Pfizers out there. So ultra-cold storage at -90 to -60 until the published expiration date, which you can find in the EUA. Refrigerated storage for up to 10 weeks. And it can be stored at room temperature for up to 12 hours prior to the first puncture and 12 hours after the puncture. And it does require diluent of 2.2 milliliters normal saline, which is a different amount of diluent than the Pfizer for ages 5 to 11. So it's really important to make sure your staff know that. Next slide, please. And the Moderna infant toddler also has mislabeling issues, but it will come with a letter in the package from Pfizer that I've put a link to here to explain the mislabeling. So it's always important to make sure you go by the EUA because the labels are a little bit incorrect just because they were manufactured so much longer prior to the authorization of the vaccine. So it might say it's for a different age group or that it has a different storage after puncture. So just make sure you go by what's in the EUA because that'll have the most up-to-date information. Next slide, please. And just another reminder on expiration dates. So all of the vaccines out there have had multiple shelf life extensions at this point. So it's really important to make sure you're double checking expiration dates. For Moderna, you can use their lookup toolkit, which the link is here. And Janssen also has a vaccine expiration date lookup tool that you can use. And for both of those, you just put in the lot number and it'll give you the expiration date of the vaccine. For Pfizer, you can look in the EUA for the expiration dates, and I've put the links on the slide to the different EUAs for the 4 different Pfizer formulations. So for those of you who are expecting to receive the maroon cap Pfizer next week, you can go ahead and look in the EUA to see what some of the expiration dates are. And then when you receive it, just look in the EUA just to double check that you know what the expiration date is. And I think that's my last slide. So back over to you, Leslie.
Thank you, Kate. And I do see questions for Kate, so we'll give her a chance to read through them. Lauren, I do see your question regarding that wonderful product guide on the easyIZ.org COVID assets page. That is being updated, but I believe it is still in process. So once that product guide is updated, we will let you know. So thank you for that question. In the meantime, Kate's going to review We'll loop back to more Q&A, but let's move on to our next slide for the vaccine management update with Eric Norton and Maria Volk. Eric?
Thank you very much. Next slide. All right. So as there's been much conversation about this. It is time for the infant toddler functionality to finally make it into our hands for us to distribute. And so within MyTurn, we want to talk about what to expect on basically Monday and Tuesday. So what we see is on that second bullet over there is that essentially we're planning to push out the functionality to MyTurn Public and Clinic on Monday night. Some clinics will get vaccine on Monday and will need to input those data. If you are processing infant, toddler, Pfizer, and or Moderna vaccinations on Monday, we ask that you use the inline bulk upload functionality. We're also sending out an updated CSV for template for the bulk walk-in upload to make sure that it passes all validation and can get in there as well. So again, we ask to use the inline and bulk upload functionality on Monday. The system will accept it. And then Monday night, we're going to deploy into MyTurn Clinic and Public the ability to create those clinics, to add that vaccine supply, and then to enable people to book those appointments, and also the ability to set those as a walk-in option as well for individuals, so you show up on the walk-in map if that's what your clinic wants to do. So by June 21st, which is Tuesday morning, MyTurn Public and Clinic will have all that functionality in the system. And again, interim, please use the inline bulk upload functionality. We have both the CSV and the inline. I personally would recommend the inline. It's basically like doing a walk-in, it's just all all horizontal, a lot of fields to enter on that one. Next slide, please. Okay, so also correcting on Monday night is that we eliminated the lock. So again, what happened is when we were sending data via the inline and bulk upload, we were sending it in such a way that it would send immediately. So we eliminated the eliminated the instant send, so that you could then have time to edit and update the data that you enter for the inline. And what happens is we would send then at 4 hours. Now what happens is the system displays an error that keeps you locked from going to the next screen to edit it, because basically there's a bug in the system that we have to push out. So this will be corrected in the next release, but in the interim, we recommend waiting for the record to be locked. You will know that the record is locked by the notification, this record is locked and sent to IAS above the name. You will then be able to proceed to the next page if you need to do something with that. So again, we just have a little workaround that we have on that. So just be patient on that one, and that'll be fixed on Monday night as well. Next slide, please. Maria.
Great, thank you, Eric. Just two quick things from ICAVAX this morning. Wanted to let you know that release 27 was launched last night, so it is live in the system now. I know we went over it in a bit more detail last week, but just as a refresher, there are, for providers, a few different updates. So for the DocuSign, when you're doing an application, previously we had signed it at the user level. We've moved that to the location application level, because we know that staff does come and go, and so it can make it difficult to track down those items if they're stored at the user versus the location application. Also for providers, we are going to be implementing a new process where users with inactive accounts for 90 days will have their accounts deactivated. We want to make sure that we've got the system as cleaned up as possible without a lot of old information, old accounts in there. We are going to start sending out reminders 5 days before, so 85 days if you haven't been active. an email will go out with instructions to go ahead and log in if you are going to be continuing to be active in the system so that you can maintain that status. And if we don't receive any response and there's no login to the system, those accounts will be inactivated. And then just a couple things on reports. Providers are now able to create their own report types when creating a report. And then we added that account name for providers to CDPH reports. So please go in, take a look at those new updates that are now in MyCAVax. Next slide. So probably the thing that everyone's most interested in, let's talk about the pre-order delivery windows. As everyone has been talking about, we are anticipating our final approvals likely over the weekend from ACIP and Western states. With those approvals, CDC and Pfizer and Moderna will begin shipment of orders. So when we did the pre-orders, we had wave 1 deliveries that were originally scheduled to be delivered on June 20th, on Monday, with wave 2 to begin the 21st through the 23rd. We've heard from CDC this week that they did have a larger number of orders than expected, so those delivery timelines are going to extend out a bit. So if you ordered in wave 1, we are now expecting those orders to arrive for Moderna the 20th and 21st, so Monday and Tuesday, and for Pfizer, they are expecting those orders to arrive between Monday and Wednesday. So you will get the email confirmation when your shipment has, your delivery is shipped, and that will give you some more information on the specific day. But definitely want to make sure that you all knew that the orders on Monday are going to be smaller than anticipated, so you don't have to worry if you're not all getting your doses on Monday for the wave 1. And then wave 2, we currently are expecting to be arriving between June 23rd and 29th. And then lastly, hot off the presses this morning, after we finalized the slides, we did hear that CDC has now opened up the system for routine orders. So any orders that came into the system after the wave 2 deadline, we've just been holding on, but we now will be able to start submitting those on our regular cadence. So we don't have specific timelines for that, but we are anticipating that they will start shipping those routine orders once they get through those wave 2 deliveries. So may be looking at after the 29th for additional orders to be shipping. And next slide. As always, as we just go through these slides, just want to call your attention that we have additional information, more detailed information on the current release, and then our roadmaps for both MyCAVax and MyTurn. So if you're interested in seeing more details on what recently has gone out and what's coming in the next couple of releases, that information is there for your reference. Back to you, Leslie.
Thank you. And as we give Maria a chance to catch her breath, thanks again to Kate McHugh, Eric Norton, and Maria Volk for those updates. I'll move to our next slide. And a reminder that additional support is available through the COVID-19 Provider Call Center. There is enrollment support available. So if you know of VFC providers or others in pediatrics specifically, or any other provider who would like to enroll, we want to ensure they can reach out to the MyCAVax info email box. Of course, there is MyCAVax Help Desk and MyTurn Clinic Help Desks, along with some great archived communication with details about updates, alerts, and the latest and greatest in the California COVID-19 vaccination program. Next slide. And we are looping back to our Q&A, but before I do that, I do want to just give one more reminder, and we are going to go ahead and drop that link into the chat for you for today's session at 2 p.m. If you're interested and able to attend today's 2 p.m. webinar, that link will be dropped into the chat in just a moment by me. And we will make sure that you guys have that information to register and to share with others who might not have been in attendance this morning, but we do want to ensure people are aware of that. In the meantime, now I will pass it back to Maria to check in with our subject matter experts and with your questions. Maria?
Great, thank you. So we've got a few questions. I see a couple answers that are typing. I see one, maybe I'll take this one. So will we be able to order a third order of the infant toddler vaccines by 5 p.m. Monday for delivery at the end of the week the following week? So Allison, that's where it's a little unclear to us what those delivery timelines will look like, given that they've got that backlog of wave 1 and wave 2. So yes, absolutely submit your order by the Monday deadline. Then those orders are approved by Wednesday. Typically, they start shipping at the end of that week or the beginning of the next week. It's likely that will still be the case, but with those wave 2 orders being pushed out a little bit, it's a little bit unclear. So we will definitely try and reach out to CDC to understand when they will be able to ship out the orders that are coming in now, and definitely share more information next week. I'm seeing another question, and I don't know the answer. I'm not sure if anyone else does. Does anyone have any information on what the shipment dates are looking like from the federal program? I'm not hearing anyone jumping in. We'll see if we can find out that information, Megan.
Hi, Maria.
Oh, hey.
Oh, sorry. This is Liz. I was going to say we can try to find once they've shipped, we can share that information, but we don't have information prior to the shipment for those doses.
Perfect. Thank you, Liz. That's really helpful. And Allison is asking, will we have a new allotment on Monday the 20th or Monday the 27th? So if you're specifically referring to a local health department virtual inventory, we are anticipating a refresh the week of the 27th, but we still do have doses available from the wave 1 and wave 2 orders that hadn't been fully used. So we should be able to submit orders this week. And as always, if your local health department needs additional doses, please reach out to us at the COVID call center, and we can work with you on that. All right, so I'm going to go back and scan our previous questions and see if there's any others that we want to pull out while we wait and see if questions come in. So let me just check in with our subject matter experts. Is there anything that you have answered that you want to verbally go over, or any other thoughts that have come to your mind that you want to share with the group?
This is Katerina. I just wanted to highlight a question that I answered about kids who are immunocompromised. So the Moderna COVID-19 vaccine, per the press release from FDA, for the pediatric Moderna COVID-19 vaccine for kids 6 months through 17 years, the authorization includes a third primary series dose for kids who are moderately or with certain types of immunocompromise, which is probably moderate to severe immunocompromise. So that's the Moderna vaccine. For the Pfizer vaccine, specifically for 6 months to 4 years, since it's a 3-dose primary series, the press release doesn't address whether kids who are immunocompromised and get who are 6 months to 4 years, whether they would be eligible for another dose. It doesn't talk about it. So I'll follow up also on the ACIP discussions. I'm sure this will come up, and we'll keep you updated when we learn more.
Great, thank you. And Kate, maybe this is a one for you. Have you heard anything from CDC about any revised COVID-19 vaccination cards now that there'll be the 3-dose primary series?
No, that's actually a good question. I don't think I've heard anything about that. So that's something we should ask CDC, but I know there is room on the cards for you to write in a third dose, but yeah, I don't know if they plan to revise the cards to say primary dose on them for the third.
Great, thank you. Yeah, I know we've been adding lots of doses and adding these things since they printed those. I'm going to imagine they probably want to use up what they have and use whatever space is on there to record it. But we'll see if we can find out how many they have left and if they're reprinting and going to make any changes. So I agree, Kit. That's a great question. I'm seeing a question from Fatima. We noticed in CARE a third dose is coming up as a booster dose and not a third dose. Does anyone have any insight as to why? So Fatima, are you saying that maybe this is someone that got an additional dose because they're immunocompromised versus a booster? And maybe you can just add into the chat so it can make sure we're answering the question. I think the system is programmed that after the primary series, those are coming up as boosters primarily. But does anyone else want to weigh in on that? All right, and I'm seeing your question about the third dose due to being immunocompromised. I will check in with our CARE team and we can report back to you on our call next week. And for our clinical team, Ada's just asking if you could repeat a summary of the dose volume for the Moderna 6 months to 17 years. Do we have anyone that could repeat the summary of dose volume for the Moderna 6 months to 17 years?
I think we had a slide on that. I don't know if we want to go back to that slide.
Yes, please. Let's go ahead and move back
That'd be
to the
great.
clinical section, and we'll bring that dosing slide up under Dr. Liu's section, all the way back to clinical, please, right there.
33,
Thank you.
32, 33.
I'm sorry, this is Katerina. Was the question about the dose volume or was it about the dosage? I can talk about the dose, but I think I don't actually know the dose volume off the top of my head. The Pfizer vaccine is 3 microgram dose per dose, and then Moderna is 25 microgram dose. I believe in the other slide previous, I think there may be the dose volume. We can go back.
Let's go back to slide 32, please.
So for the Pfizer 3 microgram, it's 0.2 mLs, and then for the 25, it's for the Moderna vaccine for infants and toddlers, it's 0.25 mLs. So I hope that answers the question. Oh, and then I think there was a question about the Moderna 6 to 11 years would be 0.5 mLs, but again, it's like a different presentation. And for the 12 to 17, it would be the same as the adult vaccine presentation. Kate, I don't know if you have other comments that the formulations have changed, and so the volume and the concentration is different between the products.
Yeah, I think that looks, yeah, I need to double check on the volume for the 6 to 11. I'll try and find that in the EUA right now, and I can maybe put it in the Q&A.
Great, thank you. I'm seeing one more clinical question for someone that has asthma 16 years and above. Can we consider them for a second booster dose vaccination now, or the primary care physician still has to determine that?
Asthma does not, oh, so for the second booster, asthma does not count as moderate to severe immunocompromise in general. Their primary care physician can also review their specific situation depending on their medication regimen. Perhaps they may qualify, but in general, it's not one of the conditions that's on the list. But their physician may know their history better.
Great, thank you. I'm seeing a request for the EUA, so we'll work on that. And then maybe someone from our education team, I'm seeing a question, where can I find vaccine information to hand out to parents for infants and toddlers?
I would say that that is all still being developed
maybe-
and won't be available until after ACIP meets.
Fantastic, thank you. Yes, I think there will be lots of information coming out just as soon as everything is finalized over the weekend. And then we know that always when these new vaccines come out, CDC is very busy updating lots of information that will be coming out very shortly. We've got just a couple of minutes. Let me just do one last check if there's anything our subject matter experts want to emphasize. Otherwise, I'm going to pass it back to you. And oops, you know what? I've just got one more that I think I should ask Kate. Kate, is it correct that Pfizer will no longer be shipping diluent 0.9% sodium chloride for the Pfizer pediatric COVID vaccines? If yes, when would that start? And it looks like the Pfizer pediatric orange cap EUA fact sheet for providers was updated today.
So Pfizer actually, I think, has put that in all of their EUAs. And they put that in there because technically Pfizer actually hasn't been the one providing the diluent for their vaccines. So when it goes to private market, I think maybe providers will have to purchase their own normal saline for it, but the federal government is definitely still planning to include the normal saline diluent in the ancillary kits. So there won't be any change in the diluent being provided to you.
Great, thank you. Thank you so much. All right, Leslie, with 1 minute to spare, I'll let you wrap us up.
Thank you so much, Maria. Thanks to everyone for the questions and for the answers. We'll move on to our next slide. And a reminder to our audience, we updated on EasyIZ the slide set. We had a couple links that were not working properly. So we've made some changes to the deck in case you already downloaded it. You can see the updated version by using that same link, and we've dropped it again into the chat for your convenience. Again, chat has all the different links, but once you download that slide deck, you're going to have access to all the links. A reminder that we have our 2 p.m. webinar today on the infant toddler COVID-19 vaccinations. Monday, we have My Turn and My CVX office hours at 12, and next Friday, we will be back again with the provider office hours. Thanks to the behind the scenes team, Rachel, Haley, Blanca, and Samantha. And we are at the top of the hour. I wish you a wonderful morning. As our music stated, it's a beautiful day. We send you those wishes and many blue skies. And with that, we wish you all the best as you continue in your efforts to vaccinate California. And we'll conclude today's session. Thank you.